Welcome back, everybody, to Let's Talk About Sleep. The Amazon link for this book is in the description box down below. As I always say, these videos are for educational purposes only. And with that being said, let's get going. So, what I want to talk about today is a little bit kind of a morbid topic, but it's an important one. And this whole idea about cardiovascular events and sleep apnea. So, when I say cardiovascular events, what I'm talking about are heart attacks, strokes, those two things mostly. Now, in somebody who does not have sleep apnea, right, the normal situation, if somebody were to have a heart attack or a stroke, let's just say let's use heart attack for this example. If somebody would have a heart attack, the most common time that's going to happen is from 6 a.m. to 12 p.m., okay? And why that is? Well, around that time, you've woken up, your body gets going, your blood pressure goes up, your heart rate goes up. These are normal things that happen as somebody goes from sleep to wake, right? So, and as we call the sympathetic system is getting activated, right? Which is kind of the fight or flight system. So those things are occurring, and if somebody has, let's say, a little clot, right, building in one of their arteries, and all of a sudden now this surge occurs, right, which happens normally, it's possible that clot gets knocked loose and travels to somewhere where it shouldn't, and a heart attack can occur, okay? That's kind of the normal circumstance. The classic example is like the old man who wakes up and he goes out to shovel the snow, right, which is a very, very common thing, and he gets a heart attack because not only has his body gone from sleep to wake, but now wake to kind of vigorous exercise, especially if he hasn't been doing that all along. So that's kind of where heart attacks occur and strokes in the normal setting. When somebody has sleep apnea, though, believe it or not, the time is a little bit different. It's actually from 12 a.m. to 6 a.m. So that 6-hour window, it's shifted in the middle of the night. Okay, and the reason for that is because this whole idea of so when we go to sleep, the sympathetic system, again, which is the fight or flight system, goes down, and the parasympathetic system goes up, which is the digestion, sleep kind of thing, right, where the body is kind of going into rest mode. Okay, so parasympathetic system is activated, the sympathetic system goes down, and that's what happens when we sleep. When somebody has sleep apnea, though, what's occurring is the airway's closing off, as we've talked about, and the blood pressure rises and the heart rate rises as the body kind of goes into a mini fight or flight type situation, right? Because essentially it's like you're choking, right? So if somebody came in the middle of the night and started choking you, the first thing you do is to fight or run, and your blood pressure and heart rate would go up as a result of that. That same process is happening, in some cases once a minute in somebody who has sleep apnea. So what occurs then, again, this whole idea about a clot, right? Let's say there's a little clot in one of the blood vessels, and it's just sitting there. And now you got a situation in the middle of the night where blood pressure is going up and down, blood pressure's up and down, and heart rate's going up and down. And the body's kind of in this intermittent fight or flight situation. That's when a clot gets knocked loose, okay? And that's where heart attacks and strokes occur, okay? So the similar idea is when the old guy gets up and starts shoveling, and he knocks loose a clot, the same thing is happening in the middle of the night in somebody who has sleep apnea. So that's why it's super important. If you have sleep apnea, you have to take care of it, okay? Mild to moderate case, probably not as much, okay? And the literature shows that. But if somebody has a severe case of apnea, I am like just gung-ho, whatever we got to do, let's do, because we want to avoid a cardiovascular event, okay? So kind of a morbid topic, but like I said, it's important to know. So the good news, though, is that if you do treat the sleep apnea, with CPAP or whatever, that risk goes down, okay? So it's kind of like, I've made the analogy before, it's like smoking, right? If you know smoking is bad for you, if you stop it, the body is happy, right? Sleep apnea, kind of the same way in some cases. It takes decades to hurt you, but once it does, the consequences are disastrous. If we take care of it, the body will thank you. All right? So that's the video for today. Thank you for watching. Please click like. Please subscribe to the channel. Please share this with your friends and family, especially those who may have sleep apnea. Okay? And if you have any questions or comments, leave them in the comment section down below. Usually once a month I make a video or two, or even sometimes three, addressing all comments and questions. So don't be shy. Feel free to fire away. And until next time, sleep well.